Going to review a clinical case with changes centered on the bladder. The dog we evaluated is an 11-year-old female Lhasa Apso that was presented for difficulty to urinate. On physical examination, the bladder couldn't be easily palpated. On this real-time evaluation of the bladder seen here on longitudinal plane, the ventral aspect of the bladder is on the top of the screen as the dog is in dorsal recumbency. The bladder is filled with a small amount of urine, seen as anechoic contents, and the bladder wall is markedly thickened, especially along the ventral and caudal wall. The mucosal margins are irregular. Several hyperechoic areas are seen within the mass and possibly within the reduced lumen. They most likely represent mineralized region and a small amount of sediment accumulated in the bladder. The cranial bladder wall is mostly spare, as most of the lesion is centered on the ventral wall. As we proceed caudally, the urethra can be seen as a thin, elongated tubular and echogenic structure, and fine mineralized foci are noted along the lumen. The strong acoustic shadowing associated with the pubic bone prevents further evaluation of the urethra within the pelvis. An ultrasound-guided biopsy of the mass was then performed, and histopathological diagnosis was transitional cell carcinoma. The dog was treated with chemotherapy. After an initial reduction in size of the lesion, the bladder mass increased in size and obliterated part of the right ureter at the trigone, necessitating the placement of urethral and urethral stents. As the clinical sign worsened, an ultrasound evaluation was warranted to assess the stent location and patency. Both stents are seen in the bladder. The thin, long catheter with an anechoic lumen represents the urethral stent, while the large and textured one engaged into the trigone region is the urethral stent. The mass had progressed dorsally at the trigone region, but it was unclear if it invaded the urethra. However, on transverse images of the trigone region, it became apparent that it was filled with echogenic material, probably representing tumor invasion. Based on this finding, the dog was euthanized 7 months after the initial diagnosis.